Iron deficiency is the most common nutritional deficiency worldwide, and it often shows up first on your skin, hair, and nails. These clues can appear long before you feel severely fatigued or get a blood test. Today, 10 signs of low iron to watch for, why they happen, and why catching it early matters. If you notice several of these, talk to your doctor. Early treatment can reverse them. Let's dive in. What is iron and why does deficiency matter? Iron equals essential mineral for hemoglobin, which carries oxygen from lungs to tissues. It's also vital for myoglobin, connective tissue, immune health, and enzymes. Low iron leads to poor oxygen delivery, resulting in fatigue, weakness, developmental delays in kids, and cognitive issues. Deficiency causes include increased demand from growth, pregnancy, or lactation. Other causes are increased loss from heavy periods, childbirth, GI bleeding, or frequent blood donation. Poor intake or absorption can also be a factor, such as with vegan or vegetarian diets, chronic inflammation, surgery, or certain medications. Now, let's explore the 10 signs on your skin, hair, and nails, starting with number 1, pallor or a pale appearance. Your skin may look washed out as the body shunts blood from the skin to vital organs. For deeper skin tones, check the palms where pigment increases fades to match surrounding skin, approximating hemoglobin below 7 grams per deciliter. Also, mucosal membranes inside the mouth and the lower eyelid conjunctiva may appear pale. Number 2, dark circles under eyes. While not always specific, this is a common sign. Possible causes include reduced circulation, making the under-eye area look more pigmented, or a pale face highlighting natural shadows. Many report improvement with iron correction. Number 3, angular cheilitis, characterized by painful, red cracks at the mouth corners, sometimes with swelling. Iron deficiency weakens epithelial cells and increases vulnerability to candida yeast. Number 4, atrophic glossitis, presenting as a smooth, shiny tongue. The tongue appears bright red, glossy, and painful, with a loss of taste buds. Iron is vital for epithelial cell turnover, so deficiency leads to atrophy. Spicy or hot foods become intolerable. Number 5, generalized or localized itch, which can be full body or especially in the genital or anal area. There's a possible link to underlying cancer, such as Hodgkin's lymphoma, where iron deficiency can be a clue. Number 6, dry skin. This can manifest as extreme dryness, worse in winter or with aquagenic pruritus. Poor oxygen and enzyme function impair the skin barrier, leading to water loss and an itch cycle. Number 7, poilonychia, also known as spoon nails. These are thin, concave nails where the edges curve up, allowing a water drop to hold in the center. This is seen in iron deficiency, young kids, and certain occupations. Number 8, brittle, peeling nails. They break easily due to poor oxygen and nutrient delivery to the nail matrix. Number 9, increased skin infections, including yeast, bacterial, and fungal infections. Impaired immunity and a weak barrier lead to more colonization. Number 10, hair loss and brittle hair. This can manifest as telogen effluvium, which is diffuse shedding. This is due to stress on rapidly dividing hair matrix cells, as iron is needed for DNA replication and enzymes. It can also worsen androgenetic alopecia, making hair dull, brittle, and breakage-prone. These 10 signs often appear before severe anemia, and early iron correction can reverse most. Focus on diet with red meat, leafy greens, and fortified foods, plus absorption boosters like vitamin C. Suspect deficiency? Get blood work, including ferritin and hemoglobin tests. Found this helpful? Thumbs up, subscribe for more skin and nutrition clues. Share with someone who might need this. See you next time. Stay healthy.